Okay, good morning, good afternoon, good evening, depending on where you're calling us from. It is your friend once again, Nurse Immaculate, the indomitable nurse. Today, just a quick one. I just want to talk about something. There's this topic that a lot of people have been ignoring, and that is hepatitis B. I've been seeing a lot of sensitization programs about HIV and tuberculosis and the rest, but nobody has anything about hepatitis B. Funny enough, hepatitis B is much more virulent than those other diseases we're talking about. So let's delve into the matter. Talking about hepatitis B, what is hepatitis B? Hepatitis B is a viral infection caused by the hepatitis B virus. So it causes the disease known as hepatitis B virus disease. This disease actually affects the liver. It's a disease of the liver. And then how do we get it? Remember, I said it's a viral infection. It is not a bacterial infection. It's a viral infection and it is gotten through the spread of body fluids, blood, semen, vaginal secretion, and the rest of it. So, if somebody that is infected have unprotected sex with somebody who is not infected, the uninfected person will get this disease depending on another number of factors, your immunity and the rest of it. You get it, but then the progression differs from person to person. From the time of contraction of this infection to the time the symptoms begin to manifest, it takes a period of 30 days to 120 days, depending on a lot of factors in the individual that just contracted the disease. So, talking about hepatitis B, what is the prognosis? Well, for hepatitis B, luckily for some people, they can go back on their own. That is, it is self-limiting, meaning that the disease can, after some time, go on its own. The person may not come down with symptoms. He's a carrier, quite all right. Each time you test him or her, you will see positive to hepatitis B. But there will never be a history of him saying, I was once sick or being treated for hepatitis B. There are people like that, so it can happen. But it is actually the number is reduced compared to those that have acute conditions of this hepatitis B. Some people will have it, and within 1 to 6 months, they are already down, seriously ill. And then what are the symptoms we see? Some of the symptoms include yellowness of the eyes, pain at the upper part of the abdomen, weakness, malaise, person is not able to carry himself, he gets exhausted at a very little thing, and then he begins to complain, I'm getting tired so quickly. These are some of the symptoms you see with hepatitis B. Now, let me not forget to mention that hepatitis B is mostly seen in people who drink alcohol. It is one of the risk factors to hepatitis B. Like I told you, hepatitis B can be cured and it can be returned. Hepatitis B can go and come back. Like we have bouts of it. For instance, you have an acute infection of hepatitis B today. And then you come to the hospital, you are treated using some viral drugs and all that, and then you get better. You could get better within 6 months. And then after that 6 months, it could actually come back. Yes, when there are repeated bouts of this infection coming back to the liver, the person can come back again with another acute hepatitis B. And then for some people, it becomes chronic. If you've had this infection repeatedly for more than 6 months, it is now regarded as a chronic condition. Now, what is so striking about this hepatitis B? A lot of people who have hepatitis B also come down with HIV. So hepatitis B and HIV are like husband and wife. If I am here, I drag you, you come along with me. You know, that kind of lovely relationship. That's what they actually have. They have a kind of symbiotic relationship. Wherever you see hepatitis B, check very, very well. In due course, HIV is going to join it. And when HIV exists, hepatitis B is likely knocking at the door. What are we trying to say? What do they have in common? Why are they always following themselves? Is because they have what it takes to break down the immunity of this person. Normally, when you're infected with hepatitis B, your immunity drops. And this is one common thing within the both of them. There has been a lot of sensitization programs about HIV, but not so much is heard about hepatitis B. It is actually very much dangerous and it spreads like wildfire. If you take a census now of this community, I can tell you almost 1 in 5 persons you test will come down with would be having hepatitis B. Although some may be carriers, while some may be in the acute phase, some may be chronic carriers, chronic hepatitis B patients. So, what am I trying to say is that you get yourself tested today and find out. The good thing about it is that there are vaccines to prevent it. It's preventable, quite alright. You can prevent it from a child. Like, it's one of the vaccines we give to babies as they are growing up. And then if you were not given and eventually you come down with it, before you come down with it, is advisable that you go get yourself tested. If you test negative to it, please take the vaccines. You can take a lifelong vaccine, three shots, 1 month, 2 months, and then 6 months. You are done. With that, you are guaranteed you won't be able to come down with hepatitis B any longer. And then if by chance you're a healthcare worker or whatever, and you found out that you've been exposed to hepatitis B by maybe coming in contact with someone who you know is positive, please present yourself to the healthcare provider immediately to give you something we call PPE. That is a kind of prophylaxis to prevent the real full-blown of this infection. So if you take the prophylactic dose, it can prevent your risk, it can reduce your risk of coming down with the infection. Thank you.